if I could ask you a question about time it takes for contact tracers. Do you have any data at the moment? We're seeing hundreds of cases a day. The average time that it takes for a contact tracer to interview someone, the time it takes for them to track down all close contacts. I know that might be kind of difficult to say in terms of absolute sense, but can you give us a rough idea of how long it's taken?
Yeah, I can take you through the process, and it's quite a complex process. We have trained interviewers and ever-expanding number of interviewers in our epidemiological team as well as in our contact tracing team, who work with cases to first of all alert them of their infection and take through with them what it means for them and what it means in terms of what they have to do to isolate, what it means for their family having to isolate, anyone else in their household and their other close contacts. Now, those interviews can take sometimes several hours to do, and we often go back to people to clarify information. So it's a complex process. It's working very closely with the people affected and their communities, and often going back several times to do that. So that process can take sometimes several hours, several days.
Okay, but how long is it taking for a contact tracer to make first contact with a positive case?
Yeah, so we aim to get everybody contacted within the day of notification. So and then we have a new system that we've introduced in the last couple of days to make sure that with the expanding number of cases, to make sure that we're getting people alerted to the fact that they're a case and isolating, and their families, their households isolating right away through texting information to them, as well as calling those who don't have access to texting, with a follow-up interview on aiming on the same day.
You say the aim. Sorry, just one last one.
We're seeing very few close contact locations, casual contact locations in Western Sydney and South West Sydney, despite the explosion of cases. Is there a different approach now in New South Wales?
Yeah, there is. We've got a lot of experience now from last year's epidemic and from this year's Delta epidemic of what the risk settings are for people to get transmission of infection from COVID. And so the information we have is that from talking to cases and looking at contacts and who's getting infected is that the highest risk is your household. The next highest risk is people visiting a household where there's a case. So we're still seeing people perhaps inadvertently or not realising that it's such a dangerous thing to do, visiting someone's household where there's a case. The next most concerning place for transmission is a workplace. So we're seeing, as we've reported here many times, workplaces, particularly factories, manufacturing, where you get a lot of people in the workplace, and that's why it's so important to make sure each workplace has a very good COVID safety plan. So I'll just finish the question, I'm sorry. And so we know that then there are quite low risk settings that we just don't see very much transmission at all in, and that's such as supermarkets, shopping centres and so on. So we're now deliberately prioritising in the metropolitan area venues or places where people have been in households, in other households, not their own, in workplaces, and high-risk settings such as hospitals, aged care facilities, educational settings, including childcare settings.
Because of the amount of work that's involved, if you have to go into all of those locations, you're better off now just targeting those resources because the case numbers are stretching them too far. That's the reality.
So what we've learnt is where the infection is most likely to spread. We also so that's why we're focusing on those areas. And we've also learnt that people just get lost in the detail when we put up venues that just we don't think are risk factors, risk places on the website or in the media. So we're really trying to focus the public's attention on those where we believe there is a true risk.
So just to be clear, New South Wales Health has stopped putting sites on the list of potential exposure sites. You've stopped putting locations that have been visited by positive cases because there are too many locations. When did that first happen?
So we continue to play in places outside metropolitan Sydney or in areas where we haven't seen large numbers of cases, such as regional parts of the state, Newcastle, Central Coast, Wollongong. We continue to put even the tiniest risk venues on the website. In those areas in the metropolitan area where we know that there are many venues that places have gone, but very little risk for most of those venues, we are deliberately focusing on those places that I've mentioned.
And when did that happen? When did that happen?
Oh, that's begun in the last few days.
We're hearing that some of those regional businesses aren't finding out that they're an exposure site until they're listed on Facebook. Are you still aiming to call them or at least text them to tell them they need to close?
So certainly in regional areas, we're continuing to take a very solid approach in terms of identifying and working with the local venues.
Dr. McAnulty, we have an update on the hospital situation on Nepean, on St George. I understand Canterbury Hospital now has exposure sites. And are you having staffing shortages now as a result of those close contacts?
Yes, thank you. So at St George Hospital, there have been transmission 4 inpatients and 2 staff members have been identified as testing positive for COVID. There's 21 patients in the wards have been tested and in isolation. No further cases have been identified to date. Sorry, I missed the rest of your question.
Yes, are there wards that are closed at Canterbury?
Yeah, there's at Canterbury Hospital there has been a ward that has been closed in light of transmission. And remember, in these places, the staff and are really concerned that they're keeping patients safe. And so they're taking all the actions they can to work with patients, follow the contact tracing and health advice, and making sure that their patients are safe.
What about RPA? Staff shortages, though, as a result of this now?
I can't comment on the staffing at those facilities, but throughout New South Wales Health, we've got very good processes for assessing which staff are at risk and how the LHD can work together as a network to make sure that the sufficient staff are in place.
Do you have detail, Doctor?
And the Indigenous population there. Are we seeing, what number of cases do we have in the Indigenous population in Far West New South Wales and North West New South Wales, and what % of the population are vaccinated?
I can tell you, I can't give you exact numbers, but I can tell you in Western New South Wales we now have 116 cases reported to 8 o'clock last night. The majority of those have been in people who are Aboriginal. So we're working very closely with the Aboriginal community to keep them safe, to make sure that people are getting tested, and making sure that people who have been in contact with other cases are aware of that they need to isolate. And special accommodation is being set up for people to make sure they are kept safe.
Have you had to transfer any regional cases via air ambulance to Sydney yet?
I'm sorry, I don't have that information. We have to get back to you.
Dr. McAnulty, there was, I understand, 2 cases that tested positive after they went to a funeral in southwestern Sydney near Broken Hill. Do you have any more details on that? I think they left the area.
In southwest Sydney, or?
Yeah, let me...
Oh, right. So there has been a funeral event in Western New South Wales, in far Western New South Wales, that we're following up. We don't have that work is still undergoing to investigate the circumstances.
Was that in Wilcannia? Sorry? Was that Wilcannia?
I believe so.
Yeah.
Yes, it was.
It was?
Can we ask you just about the number of now outbreaks, the number of hospitals in Sydney? How concerned are you about that, and what's being done in terms of resourcing? Is there any pressure as a result?
There's absolutely no question that the hospital system is under enormous pressure across New South Wales, which is why we've had to take some measures that we've talked about in the past, so easing back on some of the less urgent elective surgery. I think if you just take a look at, say, the St George situation, that was a case where we had a long-term cancer patient who became symptomatic and was tested positive for COVID. That caused, obviously, further testing of patients in that ward. The person who was in the ward in the room with that particular patient was also positive. And they found another 2 cases across the ward, and there was a nurse unit manager and a junior medical officer who were also positive. The result of that, just in that one fairly small case, has taken out 80 health staff for the 14 days quarantine. So I think that's fairly indicative. I think a few days ago we were talking about the lady who became positive in the mental health ward. She was in I've forgotten the date now, but I think it was about the 4th of August, but and a couple of days later she became febrile, had a temperature, and of course very thought-disordered patients who need high levels of care with highly specialised medical staff, and that has caused pressures in that particular facility as well at Nepean Hospital site. Look, it's fair to say that the health staff are doing an incredible job. I want to thank them. We're in the middle of a pandemic. That's not rocket science, and unfortunately a lot of our health staff are finding that they are on the receiving end of having to be taken offline because they are potentially exposed, not because they are exposed, but because they're potentially exposed, and some of them sadly have also been exposed. So that will continue. I just ask the community to be tolerant and understand that your nurses and your doctors and your physiotherapists and everybody else in the health system are working very hard for you, but we're in a pandemic and people will have to be taken offline, and we will have to have some inconvenience in that sense, but overall the health system is still extraordinarily good. We have 140,000 staff in the New South Wales health system. It's the biggest health system in the country. It deals with more patients than anybody else, so you'd expect that in the middle of a pandemic there would be cases that come into hospitals, and they'll continue to manage it extremely well, and I want to thank our staff. They are an amazing group of people, and every one of them deserves the very honest and complete thanks to the Minister and all of our community.
Minister, Breast Screen New South Wales
Can I go Lucy first, then answer? Lucy.
Breast Screen New South Wales is closing all of its clinics, it seems, across the state as of Thursday, I think. There's a lot of concern about that. Why is that a greater risk than going to the GP and indeed, retail stores that still remain open?
Look, these are obviously health issues, and it's a matter of weighing up the relative risk to patients and staff. Last year there was a period where right across the country breast screens were stopped for a period, and right now we're in the same situation. So the health staff who make these operational decisions have determined that's in the interest of everybody at the present time, staff and patients. But I've made it very clear to them that as soon as is possible I would like to see that back. But on behalf of the community, I know we all want that back, but we also have a balancing act here, and I think not up to ministers or anybody else to tell the health staff how to manage what is a competing risks, if you like.
But does that run the risk that some
Anne,
cancers
sorry,
going to go
Alex, I'll just do Anne. I said first, and I'll come back. Sorry.
Can you tell us what arrangements are in place to move people from Western New South Wales if they require intensive care treatment? Is there flights organised? Where are you taking them? How many beds are there? Can you just give us a better feeling for it?
Look, it's the same situation as per any other time, really, but with a bit of extra resources, obviously. In some of those remote communities, such as Brewarren and Wilcannia, they have very committed health staff, but when there are very urgent cases that have a need for high-level ICUs, they're generally transferred to Dubbo or to Orange or occasionally Bathurst or indeed into the city. I wrote to Minister Hunt, I think it was last Wednesday, and I asked for assistance on behalf of the New South Wales Government in regard to ADF on the ground, particularly with regard to supporting the team, our health team on the ground for vaccinations and so on. And in fact, I spoke yesterday to the person who leads the team at Walgett Aboriginal Medical Services, which is the biggest health service in, for example, Walgett, and she was indicating to me that she was really looking forward to having the support of the ADF because of the logistical needs, the structural needs to support people, and with that comes the possibility that there would be improved transference into the major centres if a patient needs it. Many patients, let's not forget, many patients don't need it. I mean, roughly about 80% of patients who get COVID can be managed at home. In fact, that's where the majority are, they're at home. But unfortunately, there are some who deteriorate very quickly, so we need to have that facility. We've got the Royal Flying Doctor Service as well. And in fact, just before this press conference, I actually rang the same person, by first name, Christine, if you're there. Thank you for all the work you're doing in Walgett for all of the community there. But can I say, she also just texted me back and said that they have seen a military vehicle in Walgett, and they're looking forward to having more on the ground as soon as possible.
Deputy Commissioner Farkas.
Oh, sorry, just Alex, and then I'll move and let you have it. Alex.
Hospital was admissions overnight, 50 or so extra people gone into hospital. We're hearing the situation was particularly bad again at Westmead last night. Can you give us any insight into that? Long delays for paramedics, again waiting in the car park, and they're telling us that doctors are coming out and doing their checks in the car park, effectively triaging the car park.
Look, again, in urgent times, it also happens during flu seasons. There are times when doctors who are highly capable and medical staff, our nursing staff, will come out because there might be some cases that are blocking an emergency department. That's not unusual. It happens in every system across the world. Desirably, if you had less issues happening, patients would be moved straight in, but they still get world-class care from our amazing physicians and nurses. So I don't think anybody needs to have undue concern about that, but also recognise again, we're in the middle of a pandemic. There are people coming into the hospital and putting that additional pressure on, and I just want to again thank our staff. They're doing an incredible job, and I'm sure, Alex, if you were there, you'd find in that situation you'd be extremely well looked after.
Deputy Commissioner, if I could ask you a question about the past 24 hours of fines. Thank you, Deputy Commissioner. In the past 24 hours, of those 500 or so fines that have been issued, have any $5,000 fines been issued for lying to contact tracers? And if I may ask you another one, could you...
No, one at a time, thanks.
Thanks, Premier. I'm not aware of any fines of $5,000 for contact tracers, but it's certainly an area that we think that the fine will provide some strength to the case officers and indeed the people who are supplying the information to make sure that their memory is good and that they supply that information quickly to allow us to then get on with the process in terms of the contact tracing itself. And then on the back of that, what we will see is ADF and police going around, hopefully within 24 hours and knocking on the door, making telephone calls. Yesterday, 2,300 plus premises visited. That part of the contact tracing is going to be so important to make sure that people stay at home. And I think that whilst I'm not aware yet of any $5,000 fines, I think that that is just a very strong message to people that the game is up, that when you're asked questions about this, the issue of where you've been and who you've spoken to, that you really do need to come forward with the truth in the shortest possible time.
Premier, if, as you say, September and October is going to be our most difficult months, how can you also promise freedoms in that time? And can you be a bit more specific as to what exactly you're talking about? What are the freedoms you need?
I've been asked this question a few times, as is Dr. Chant, and we've tasked her to consider if people are completely vaccinated, what low-risk activity can we provide once we get to 6 million jabs during September and October? And she is considering her advice, and I want to make that very clear. So I have always set ourselves a target of getting to 6 million jabs by the end of August, and I'm so pleased that we're going to get there with a bit of room to spare as well, fingers crossed. But that will mean that we can consider opportunities for people who are fully vaccinated in September and October, and I'll be able to convey that as soon as we get closer to that August 28th day, and as soon as we know where things are at in terms of case numbers and areas of concern. And the challenge for us is we want to make sure those opportunities are made available to as many citizens as possible. So it does depend also on what is occurring in those areas of concern. And it's really important for us to keep the community updated as soon as we know anything. But at the same time, we need to allow our health experts the right opportunities, the right time to be able to provide us that advice. So. Yeah.
Case numbers, and September's only in 2 weeks.
Yeah, can I make it very clear that we are assuming that case numbers will go up. Now, I say that only as a realist, because when you have cumulative days of high case numbers, there is a tipping point where case numbers go up. But our challenge is to make sure that we keep vaccination rates up, because the more people that are vaccinated, the less likelihood of hospitalisation and the less likelihood of death. And we know the vaccines, either vaccine, have proven to be extremely useful and extremely protective against people ending up in hospital. But also, we know from the health experts that after the first dose, you get the first dose, 2 or 3 weeks after you get the first dose, you also see a reduction in how contagious you can be if you do get the virus. So we know it will have an impact on spread as well as keeping people protected. So given that we're now deploying at least 600,000 vaccines through a targeted approach in those areas of concern, that we will have in 2 or 3 weeks' time a much greater proportion of the population who are protected against spreading the virus further, but also protected against hospitalisation. And the key challenge for us is getting to as many of those hundreds of thousands of authorised workers as quickly as possible between the ages of 16 to 39, because we know that is the age group from those areas of concern that are going out and doing those essential jobs that all of us rely on, doing those essential jobs which keep food on the table and keep services that we need happening. And as soon as we can get all of them protected, the results will be indicated in terms of reducing the spread but also reducing hospitalisation. So all of these factors are taken into account. But I do want to stress that once we get to 6 million, it does give us options as to what we can consider in the months of September and October, and obviously by the end of October we will get to 70% of double doses, which gives us more options about what we can do. So whilst there will not be complete freedom at 70% or even 80% depending on the case numbers, life will be much freer than what it is today, and that's the point I want to make. Because even countries around the world with 80% double dose vaccination still rely on QR codes, mask wearing in certain settings. So we know that whilst the Delta variant in particular is very active around the world, there'll always be a level of protection we need to have. But life will be much freer than what it is today, and that is the key point. That we won't have to live with the harsh restrictions that we're living with today. But that's why today and in the last few weeks we've done a call out not just to people in those areas of concern to get vaccinated, but especially our older citizens. If you're over 70 anywhere in the state, please do not hesitate to get the vaccine, because that will protect you into the future. So even if you're not worried about it today, when we're at 80% and the community is freer than what we are today, that does increase the risk for people who aren't vaccinated. People who aren't vaccinated will have a greater risk of ending up in hospital or dying. We don't want to see any of that happen. That's why in particular we're saying if you're over 70, and the vaccination rates have gone up substantially in those age groups, but if you're over 70 anywhere in the state, and the Deputy Premier made the same point for our regions, your region, your city may not have had a single case during the entire length of the pandemic, but please know down the track in the months ahead, when we get those higher rates of vaccination, we start opening up, people who aren't vaccinated will have a higher risk, and we don't want to see anybody who's vulnerable susceptible to any risk. We want to make sure that people are protected as much as possible.
If you're saying that the cases are going to go up in the current settings with the current restrictions over the next 2 weeks, that's what you said, you think that the case numbers will go on. How can you then take the foot off the brake, even for people who are vaccinated? We know that vaccines don't stop fully the spread. So you're saying case numbers are going to go up in the current settings. You're willing to see case numbers go up even further if you take the foot off the brake.
But we know even now, even during a strict lockdown, any community anywhere in the world, even during a strict lockdown, whether it's New South Wales or any other state, still allows citizens to do certain activity. In New South Wales, some of those activities...
The case numbers going up has massive ramifications for people.
Can you please let me finish my question?
The case numbers going up, if it reaches over 500, it has ramifications for people in the rest of the country. So are we willing to let that happen?
As I've said, and I'll say again, when you get to a point where a particular proportion of the community is vaccinated, there are considerations for fully vaccinated people to undertake low-risk activity, which other states around the world with similar situations to New South Wales, or far worse situations than New South Wales, are already doing. So we are looking at, I am not about to make any decision, or I should say the New South Wales government is not about to make any decision which is going to either impact our case numbers or else risk human life. That is not what the New South Wales government does. But is it our job to look at how we can allow the community to live as safe as possible and provide an extra freedom? Of course that's our job. I would never expect anybody to suggest that we should sit on our hands and just let people live the current way for the next couple of months. We always have to challenge ourselves. We have to make sure that they're educated decisions based on the health advice. But if there are low-risk activities which can be identified in September and October, we'll provide those opportunities. But having said that, please know we are putting our foot down in terms of reducing the case numbers. That is critical. But the reality is, given the number of cases we've seen in recent days, I would not be surprised if those case numbers continue. That is not the trajectory we want for New South Wales. But we also have to be real about what is likely to be around the corner. But we also have to know that vaccinations are a good way to keep us safe and out of hospital, and to make sure our loved ones are protected.
We have the toughest restrictions in Australia and Greater Sydney.
Oh, look, you have to look at all of the settings in total. But if you look at the length of our lockdown and the restrictions we have in place, it is a combination.
Masks outdoors, playgrounds closed.
It is a combination of things, and even during the harshest time of the Victorian lockdown last year, citizens were still able to do some things they can't do in New South Wales. So you have to look at the total package of lockdown and strict lockdown conditions. There are still things. There are still things we can't. There are still things we can't do, and as we know, dealing with Delta through a short, sharp lockdown doesn't necessarily work either. So we have to be real about that. The Delta variant is like nothing we've seen. And we all have to be real about that. Sorry?
I asked you about regional permits. In Saturday's press conference, you said the technology was there for Service New South Wales to roll out the permit system to cover the regional areas. If that's the case, why are applications only opening at the end of the week when the permit system starts on Saturday, and how long will it take to process?
Yeah, no, we made very clear the day we announced those extra measures that the permit system would be, the actual permits would be issued from Saturday. But please know the police officers, police force can still book someone based on the information they have. The permit system simply makes it more efficient and takes less time for police officers to get to the bottom of the case. When police pull you over or confront you, they will know when you're doing the wrong thing. But it will take them less time if there is a permit in someone's hand to be able to say that that person is travelling legally. And that comes into place from Saturday. But until that time, make no mistake, the police have the ability to fine you those substantial fines or worse. But obviously it may take them longer. But the permit system, which comes into effect from Saturday, gives them the opportunity to do it more efficiently and quickly.
Premier, the LGAs of concern, the dozen LGAs of concern, can you confirm there is going to be some adjustment there with the 5K rule, that people who are going shopping or exercising in those LGAs cannot go into the next LGA that they're bordering on?
Well, no. In those areas of local concern, there is a flat rule of a 5 kilometre radius from your house. So you're not supposed to go anywhere beyond that 5 kilometres.
Can you go into the next LGA?
Well, it depends. You might live right on the border, right? So if you live right on the border, that's why it's a simple rule in those local government areas of concern. You're not supposed to go anywhere outside of a 5 kilometre radius of your home, irrespective of the local government area, because obviously if you live right on the edge of the street to the boundary, that limits your opportunities to go perhaps to your closest shop might be 100 metres away, but in a different LGA. And that's why we've made that rule, to make it clear. If you're in an area of concern, you shouldn't be doing anything outside of, well, firstly, you shouldn't be leaving your house. But secondly, if you do need to leave your house for an essential purchase, you should do it within 5 kilometres. If you're doing exercise, it should be within 5 kilometres. And obviously, we only want you to leave home if you have to for work purposes or for vaccination.
On the thresholds, Premier, if we're easing restrictions when we get to 70 to 80%, how are you going to manage the risk to regional and rural New South Wales? Will that 70 to 80% threshold, will that be a statewide total that when Sydney gets to 70 to 80%, the whole state will start opening up, or will Sydney start opening up when regional and rural New South Wales will still be locked down because they will not be anywhere near 70 to 80% double dose? Well,
these are the challenges that the New South Wales government has to consider moving forward, and that's why we're encouraging, firstly, people in areas of concern to make sure they take the opportunity to get vaccinated. And as the Deputy Premier said today, we don't want to see any rural and regional communities who may not have felt the need to get vaccinated until this this point in time, have lower rates of vaccination than the rest of the state. So ideally, you want those high levels of vaccination to be equal across all the state, but we're confident we can get there.
So
we're
Premier,
confident that the people of the state will come forward to get vaccinated, but we don't want to see any community left behind. And ideally, given the concentrated effort in those targeted areas of concern, we'd love to see those vaccination rates go even higher than 80%. So it's really important for us to not only target the areas of concern, but also to make sure that there isn't any part of our state which has lower rates of vaccination than the average, because that will ensure safety. It will also ensure that particularly vulnerable communities will be protected once we get to a stage where people have greater freedom. Because once you start opening up, when you get to the 70% or the 80% double dose, people who are unvaccinated will be exposed, and we don't want to see anybody unnecessarily go to hospital or worse. So we are really working towards getting increasing rates of vaccination as quickly as we can across the entire state, and increasing the availability of the points of access for people to come forward.
Specifically, Premier, will Sydney need to wait until regional and rural New South Wales get to 70 to 80% double dosed, or will the whole state start opening up when the whole state's population gets to 70 to 80% double dosed, even considering the fact that that will mean some remote communities aren't vaccinated at all?
Well, these are the difficult public policy decisions our government will need to take as we get closer to those targets. But that's why we have, and can I again thank Susan Pearce and her team, we don't do it enough, but they are working around the clock to get jabs in arms across the length and breadth of our state. And points of access, as the Deputy Premier would know, points of access in rural and regional communities are sometimes more challenging because your GP may live a considerable distance away from your home, your closest health site might be further from home, but we're making sure as much as possible that people have access to the vaccine, that they can confidently take it, and make sure that we get those rates up in every part of our state. And there is now the ability to look at the vaccination rates by postcode through the New South Wales Health website and through Service New South Wales. So now you'll be able to look up your postcode to see how the rates of vaccination are in your community. But obviously, we will be safer if we have those high rates of vaccination universal across the state. We know that's not the case yet. And just to give you an example, in some parts of Western and Southwestern Sydney, we only had vaccination rates of first dose at around 19%. In some of those same communities, first dose vaccinations are now in their late 40s. So in the last 3 weeks, there has been an incredible jump, and I'm so heartened by that, because it means there's an extra layer of protection, but also we can see, or start to see, not yet, but in 2 or 3 weeks' time, a further reduction in the spread once those jabs take effect. It does take time.
Can I ask again about schools? Is it realistic that they will go back this term? It seems not. And if that's the case, can you tell people now, and perhaps give us an idea of when you'll be able to outline a roadmap? I realise it's really hard because they're not vaccinated.
Yeah, we are still working on the roadmap to schools and what education looks like in fourth term and third term. But that is why we're planning ahead in vaccinating, obviously as a starting point in the areas of concern, all the HSC students. We made that decision knowing that we want HSC students to be able to sit for their examinations, which is a requirement for them to attain the HSC. So we're very keen to make sure, firstly in the areas of concern, and more broadly that everybody feels safe when they're sitting for their HSC exams. And we're also looking at opportunities obviously in September and October for vaccinations amongst broader numbers of students who are eligible to take the vaccine. So that is a strategy in hand. Health and Education and other government agencies are working very closely as to what school can look like and might look like. And we know that parents want certainty, as do I. One of the things that causes me the most stress, and I have to say this honestly, one of the things that causes me most stress is the stress that I know households go through when they're homeschooling. And we want to provide that certainty. But we also know parents are stressed about the safety of their children. Unfortunately, Delta is impacting young people unlike other strains. Young people aren't spreading it, not necessarily getting it in high numbers, but obviously we want to make sure that children are protected. And that is why we have to have a school safety plan that addresses those concerns, but also the health needs of younger people during what is a particularly nasty strain of the virus.
$87 million in
business grants, Premier. In business grants, Premier.
It was a crushing blow yesterday for many people to hear that 80% vaccination is probably not the ticket to freedom. Can you give them anything to cling to today about what much freer means? In November, will we be sitting at restaurants? Will we be seeing our family?
I was a bit more concerned, about some of the commentary around the comments yesterday. 80% double dose means we can be freer than what we are today, no doubt about it. But does it mean we forget QR codes? Absolutely not. Does it mean particular events will require double dose vaccination? No. So we are working on a plan now as to what life will look like at 80%, and it does depend on the case numbers at the time as well. It doesn't mean that we'll be living the way we are now. We'll be living life a bit freer, but the level of freedom will depend on the case numbers at the time. In some countries, which is not the strategy of the National Cabinet or the New South Wales Government, in some countries, once they get to a particular rate of vaccination, they don't care. They just say you have complete freedom, don't check in, don't do anything else, and then they see thousands of people with the virus. We're not about that. We're about making sure that when we hit those vaccination targets, we're considering the safety of our citizens, we're considering what restrictions still need to be in place to protect people who aren't vaccinated. But will life be much freer at 80% double dose than what it is today? Absolutely. But we don't know exactly what that looks like until we're closer to that time. And at the moment, we get to 70% double dose at the end of October, we get to 80% double dose in mid-November. But the extent of what we can do is dependent on rates of vaccination, obviously, but also where the case numbers are at. And ideally, we need to see them much lower than where they are now if we want to live life freely prior to the outbreak.
Deputy Commissioner.
Last question. Sorry.
$687 million in business grants, Premier.
I'm sorry?
$687 million in business grants that still haven't been paid. Will that $687 million be paid to businesses who have applied by the end of the week? Will that be cleared?
Yeah, I'm pleased to say that the wait times are now down to 10 minutes on average for businesses applying.
That's just for the call centre when people call to ask where their money is.
Yeah, please. I was about to get to that. So obviously we're pleased that the wait times have reduced, and on average, businesses are receiving the money in their bank accounts within 4 or 5 days of making their application. So we again apologise for any frustrations or delays that were experienced. I understand there's nearly $1 billion that's gone out the door in terms of business support, but also please know that irrespective of where you live in your circumstances, that there is help and support for you as an individual through disaster payments through Service Australia and of course through Service New South Wales for business grants. So we've reduced the wait time substantially. The last report I had told me the average wait time was 10 minutes, but also in relation to getting the money in your bank account, the average day is 4 to 5 days after application.
So
Deputy Commissioner.
Could I ask about vaccine incentives really fast? Could I ask very quickly about
last
vaccine
question
incentives?
for me,
Sorry,
and then Deputy Commissioner, and then that's it. Sorry.
You had mentioned that.
I'm sorry.
You had mentioned that that you were looking at vaccine incentives, like things like the Die and Discover. Where is that at?
Yeah, that's why I'm urging everybody to get vaccinated. If you want to get back to work, and if you would like to attain a service that you currently don't get to do, we're encouraging everybody to get vaccinated because full vaccination will give us opportunities to provide individuals during September and October. That is what we're considering, and that will depend on the health advice. But having said that, I just don't want anyone to be under any illusion that we desperately need to get those case numbers down. So yes, there are opportunities for greater opportunities for freedoms once we hit our vaccination targets, but they will be limited if case numbers are to remain too high. We need to get the case numbers down as much as possible to allow us to consider greater options and opportunities. And I think people understand that. It's obviously the higher rates of vaccination and the lower the case numbers, the more opportunities we have to give people safe options. And that's what I want people to consider in the next few weeks. Deputy Commissioner will answer the final question, and then we'll be back here tomorrow at 11 o'clock.
Deputy Commissioner, just very quickly, we know that household transmission is really the biggest concern at the moment, and we've got an increasing problem of people going to other people's houses where they shouldn't be. How is your operation actually targeting that, though? Because we know that police aren't randomly door-knocking houses. They're only going to close contacts. So have police actually given out any fines to people for being in someone else's home without reason?
Yeah. the Commissioner's Operation Stay at Home is applicable and has been wound out to every police district, every police area command, every specialist area. The Police Operations Centre is open 24/7 every single day, tasking and deploying police to places where they best need to be. So in terms of the household, the hundreds of tickets were issued yesterday, 579, but of that there were well over 100 tickets issued to people for being outside their house without a reasonable excuse. And that continues.
In someone else's house, though?
That continues to be a trend where what we would say is that people who are outside their house without a reasonable excuse, one of the only things that you can factor out of that is they're going to visit someone. So police certainly are doing plenty of door knocks in terms of those people that should be in their home, isolated or quarantined in their home. But the mere fact that the presence and the visibility of police right across New South Wales, stopping and propping people, whether they're in a car, whether they're walking down the street, I think sends a really clear message to people that if you want to step outside the public health orders, you will get caught.